So, Om Shri Gurubhyo Namaha. Namaste to Madam Girija Madam and to all the participants. It's a great pleasure to welcome you to today's webinar. This is the second in our Ayurveda in COVID-19 webinar series. Clinical encounters with COVID-19 patients is the topic today. As we all know, COVID-19 is escalating in India, and there are more and more patients, contracting this virus and becoming sick all over the country. And the allopathic system is not really fully able to cater to the needs. And in the wake of a pandemic like COVID-19, we cannot wait for research to discover medicines. Patients need to be addressed, immediately with the best clinical care that is possible. And in India, with a pluralistic healthcare system, Ayush systems, Ayurveda, with its thousands of years history and experience in dealing with epidemics and pandemics, definitely have a role to play in the clinical care of COVID-19 patients. So it is through the initiative of individual practitioners that we are even able to understand that systems like Ayurveda can make a big contribution in taking care of COVID-19 patients, giving clinical care, helping them recover much faster and with less difficulties. And here we have today Dr. PLT Girija Madam from Sanjeevani Ayurveda Foundation. Is a living testimonial and example and a proof of what Ayurveda can do in dealing with such pandemics at the clinical front. So it's a great pleasure for me to once again welcome you, Madam, because people are eagerly waiting to hear from you. I would like to also announce that we have with us Dr. Narayan Tripathi. He is the Vice Principal of Amrita School of Ayurveda. We were expecting our Medical Director and Principal, Swami Shankaramritananda Puri, to also join, but because of an unexpected engagement at the last moment, he couldn't join. So Dr. Narayan Tripathi will be, summing up and giving the concluding remarks at the end of our session. And then we have Dr. Professor Anantaram Sharma. He's the discussant I hope he will come online in a moment. Dr. Anantaram Sharma is the discussant, of today's meeting. Is professor and head of the Panchakarma department at Amrita School of Ayurveda. Dr. Sharma will also be asking you the questions. Today we are going to have a dialogue. So he'll be asking the questions one by one. So now I would like to invite Dr. Shyam to give an introduction briefly of Dr. Girija Madam, and then we will go into the session.
So, good afternoon to one and all. It's been a great pleasure to have Dr. Girija, Dr. PLT Girija, who is the Chief Physician at Sanjeevani Ayurveda and Yoga Center, Chennai. She has been a very good clinician since many years, and she has been treating cases of all kinds and with good results. And of late, with this pandemic, Dr. Girija has been very successful in also treating many COVID-19 patients, and she has had hundreds of cases being treated by her. So it would be a very interesting thing to hear from her. And it is also a very important thing to note that she was the first physician to publish a case report on treating a COVID-19 case with Ayurveda. So with this very short introduction, I would not take much of the time. I would invite Dr. PLT Girija to share her experiences of treating COVID-19 patients. And I invite Dr. Anantram Sharma, who would be, posing the questions, and accordingly, Dr. PLT Girija would be answering them.
Dr. Sharma, you can please start.
The sound is not. No.
Dr. Sharma, can you hear? Please start the question. Dr. Sharma,
Sir.
can you hear? Yeah, please start. You can start with the first question.
Sir, actually, I didn't receive the questions in that mail. There is no attachment seen.
We will just start in a moment. I would request Dr. Shyam to read out the questions.
The first question is, Madam, to you.
Yes.
What type of patients with COVID-19 are you treating? Of which category? Mild, moderate, severe? And what is the number of patients that comes under mild, moderate, and severe? What is the percentage, roughly, approximately?
You can hear me? Can you hear me? Hello?
Yes, madam. Yes, ma'am.
Yes, madam,
Okay.
we can hear.
Yes, ma'am. You're audible.
Okay. I would like to look at this with a slight introduction. This COVID-19 is a term introduced to us by the West because they were facing a new virus and a new disease.
Okay.
Initially, we were bombarded with news from the West regarding the virus which is causing huge deaths, and whatever information we got, based on that we arrived at some understanding. There were also autopsy reports saying that it is causing blood clots in the system, in the lungs, in various organs. Then Vaidyas, we had no personal experience. So being a virus, then it was said it is Agandujam. Then there was speculations about whether it could be Vishajanya Vyadhi. And all these, then there was, it could be Sanipadajam. It was all speculations. All the Vaidyas all over India, they tried very many clinical trial protocols. I remember we wrote 4 of them, even though we believe that none of the Ayurvedic medicines require any clinical trial. But somehow we need to get to this disease. If it means clinical trial, okay, clinical trial. So finally, nothing succeeded. And looking back, I think that it was good that nothing succeeded, because otherwise, Ayurveda people, we would have made a fool of ourselves trying to go to allopathic institutions and trying to do something there. Then finally, when everything failed, then anyway, during the pandemic, we kept working, and slowly, one by one, we realized that patients started contacting us. In fact, the very first patient was, of course, one of our very difficult patients, and that patient was referred to us because they felt that Ayurveda would be a safe treatment for her, considering her conditions. Then on, many patients, one by one, started coming, and we started treating. Of course, in the beginning, there was a lot of hesitation of how openly we should do it. So till we crossed about 20, we were being very quiet and we didn't even speak about it. Then, of course, word of mouth, one patient to another, it was our patients of COVID-19 started arriving. So we would now, after treating a fairly significant number, we would like to define this in a certain way. First of all, I think we can put it out of our mind, this coronavirus and COVID-19. COVID-19 we have to say because it is some name given to it, but about this, we can put that aside and let us see what is the Ayurvedic diagnosis and what is the nature of this disease, and that will give us what type of patients arrived. Now, whenever we face a new disease, and then if we are not familiar with it earlier, then we would go back to our text. And where is the first slide? So, just as an introduction, yes, all of us know it. Even then, it is just a maryada I should pay for Ayurveda that it has given us this sloka, that it will always be a backup for us. Where is it? In this, it doesn't come? No, we'll have to. I think I might as well. I know the sloka by heart, I can as well say it. Okay, now it goes. Vikara nama kushalo na jihriyat kadachana nahi sarva vikaranam navatosti dhruvasthitihi. So in fact, I'll come to it later. This is not even an unknown disease. I hope I'd be able to demystify this whole build-up about COVID-19. So eva kupito doshaha samuttana visheshatah स्थानान्तराणि प्राप्य विकारान् कुरुते बहून् तस्मात् विकार प्रकृति अधिष्ठान अन्तराणि च बुद्ध्वा हेतु विशेषांश शीघ्रं कुर्यात् उपक्रमम्. So even if it's a new disease of unknown whatever origin, but all we need to worry is what are the doshas which is in the Kupita state, what is the sthana, what is the adhisthana, what are the other nidanam, and then we have to, by understanding this, that Vaidya is supposed to Shikram Kuryat Upakramam. Now, after seeing the patients, it is very clear it is a Vata Kaphaja Jwaram. I can assure you, all of you have treated Vata Kaphaja Jwaram, and it is nothing very different from what you all have seen already. Even though you have been asked not to treat COVID-19 patients, you have treated it all along. So, Charaka Samhita says, Shitako Gauravam Tandra, Saimityam Parvanam Chiru, Shirograha Pratishyaya Kasa Sveda Apravartanam, Santapo Vadyavegasya, Vata Sreshva Jarakriti. Prashangadhyam says, Tapahani, Haruchi, Sarvashiroruk, नीरस श्वसन काशविबन्ध शीतजाड्य अतिमिर भ्रमतंद्र श्लेष्म वातज जनित ज्वरलिंग. Now, all these symptoms we are familiar with. But a very important thing in both this sloka is, Charaka says, Madhyavegasya, and Ashangaridam says, Tapahani. The more and more COVID patients we see, this is very, very obvious that it is Madhyavega and Tapahani. Most patients will tell you, we had mild fever. I had 99 fever, 100 fever, 101 fever. Someone will say, I felt feverish. They don't even say they had major fever. So, Madhyavegasya. Tapahani. This is the same thing. So, in COVID-19, you would find that some of these symptoms are there. Of course, one of the major symptoms most people have is kasam. Kasam is there. Some of them, suspinasam, pratishayam, it is not something very major because the Vata Kapha Jwara is inherently Madhyavega Tapahani. So, if you say, instead of saying mild, moderate, these are categories, we can't really say what is mild, what is moderate. But the very inherent nature of the Vata Kapha Jwara is this. If you see severe cases, it is only because it has not been treated. So you allow the disease to degenerate and become more severe. So a disease, Vata Kapha Jwara doesn't start out as a severe condition unless it is not treated or wrongly treated. So now you can understand what are the types of patients that came to us. Now, can we have the next question, please? Can you hear me? Hello? It went off.
No, we can hear you.
Yeah. Does that answer the question?
Yes, Dr. Shyam will just come in.
Why so much? Hello. Hello?
Yes, ma'am. Is it audible?
Yes, now it is.
Yes, yes. Ma'am, whether these patients are referred by any other doctors or they are directly walking to your clinic, how it is happening?
They are, maybe about 5%, maybe referred by Western medical practitioners. Others are,
Okay.
by and large, people are aware of Ayurvedic clinics and Vaidyashalas which are functioning in the city, and we have been there for many, many years, so they are aware and they come. And also our own patients, I know when they come before, some of them we ask, how do you come? Then they say that we sort of inquired. And so they get some reference saying this is a place which does some serious Ayurvedic treatment. So they are sure that it is these are places which are treating also COVID. So that is how they come. Word of mouth, and some referral.
Okay.
Very few referrals.
Okay. Are you directly doing the clinical examination on the patient, or you are doing some remote consultation through telephone or something like that?
There is. Hello.
Hello, ma'am. We can hear.
Yeah. In fact, when they contact us, we tell them not to come in person, but to send a contact who is not in direct contact with them, and who would also, after they come, they sign a consent paper, and then we have a long conversation with the patient on the phone to elicit whatever information we require. And then on, it is a matter of, when necessary, twice a day. When we are more worried about them, then we'll call them twice a day over the phone. Otherwise, once a day, a phone call to just make sure if we need to change any medicine, is there any problem they are facing, all this to be done. Because in treating that, we have to also safeguard our staff and our doctors who are working very hard. So no point in losing them, in the sense they are, if they fall sick, the next 2-3 days gone for one staff, and so that would be difficult. So this was a very safe way it's a safe procedure we arrived at. Yes,
Okay.
can I?
So based on a written consent, only you are treating all these kind of patients.
Yes,
That's good.
based on
And
written.
okay. So are you following these Ayush guidelines or your own protocol, or whether combining both of these two and practicing?
In fact, I brought a sheet. You can see me, right? Yeah.
Yes.
See, we took a case record form. This has been taken directly from the protocol that they had released, Ayush had released. And so it has basically the demographic details they ask, chief complaints they have asked, then travel history, contact history. Then there is onset of vital signs, comorbidities, medical history, then some Ayurvedic examination, then provisional diagnosis, then assessment as per the Vaidya, then viral clearance and others. Then there is also a consent form, and after that, then there is a page which we use for every day. The doctor has to write a note whatever the patient is saying, and if there has been any change of medication, then they would have to record. So this is the form that we use, which is basically taken from Ayush protocol. And regarding medication, Ayush protocol has been so comprehensive, in the sense it has left out nothing. It has given a whole lot of medicine, so that people from different parts of India, they can use whatever is they are familiar with. And so we have largely our medications are based on this protocol, except a few we sort of introduced it for some reason.
Okay, ma'am. Are you customizing the treatment for each patient? And if yes, how effectively you are doing these at different stages?
Definitely, we have to customize. We have, first of all, we have different types. For instance, an asymptomatic patient or pre-symptomatic patient. Definitely, we'll have to see what is the prescription that should go to an asymptomatic patient. So how do we understand an asymptomatic? Why should a person without any symptom be treated? Just because they have come COVID positive is the first question you will have in your mind. So anyway, they are positive. So what do we do? In fact, I can give you an example. of patient who, this was again my second patient, was an asymptomatic person. I asked him, what is the symptom? Nothing. Why did you go and check? Because my driver turned COVID positive. I came into contact, so everybody in my office was checked. Then we need to look at the patient to see what is the nature, in the sense what is the food habit and what are the physical um, sort of problems, if any. So we need to see, basically, I looked at it like this, whether we need to do a Santarpana approach or whether we need to do an Apatarpana approach. Now, in this case, that patient was largely a vegetarian, not on coffee, tea, milk, ghee, nothing, and did a lot of travel, and slightly sometimes food a bit irregular. So definitely he required a Santarpana Chikitsa. So we gave Amrita Prasagritam in the morning and Indukanda Gritam in the evening, and with Guduchi Kashayam. Now this, and then corrected some habits, some changes to eat on time and all that, not to sleep during the day, all these instructions. And on third day, he tested negative. Then he tested again and it came negative again, because they were surprised. In 3 days, he tested negative. So you see, just because he's asymptomatic, that doesn't mean we should immediately rush him with all kinds of medication. So this is one avastha or customizing, I would say. The other thing is, of course, Amavastha of the Jwaram, everybody knows. Then after a few days of treatment, you are very definitely likely to come across Jirnavastha. That is Kafe Mande, because we are giving so much of Kashayam, Churnam, tablet, everything which is Kapha Vataharam. So, Kafe Mande Vatapittotare Jware, Paripakveshu Dosheshu Sarpishvanam Yathamrutam. So definitely, after a few days, it is very important that we start the patient on ghee and milk. So this is why every day we are speaking to the patient, and then at some point we decide resolution of symptoms, everything's over. Dosha in a pakwa state, there is absolutely nirama. Even if there is a little bit of fever, it is a jirnavastha, so you need to introduce ghee in the diet and as medicine. So this is again another avastha. So then we find yet another avastha, which is quite often, I mean, in the sense we have seen it in a few patients, that after some time, patients keep saying that we have a little bit of fever, and on the 6th day, sometimes 7th day, they get a little bit of loose motion. Now, this loose motion, this Atisaram, is very different from starting with Atisaram. To begin with, they don't have Atisaram. It is not that Jwara Atisaram they had, so we quickly think of a Jwara Atisara Chikitsa. It is not that way. Here, they may have a little loose motion and a little bit of fever is not getting resolved. So then there is this avastha specifically mentioned, Shira Uchitasya Prakshina Sleshmano Dahatritvatah Shiram Pitta Anilartasya Patyam Api Atisarinaha. Now, I would give an example. This avastha, it was about 8 years ago. One of our doctor's child, 3-year-old, started with fever, and fever was at 106. Now, it seemed a bit tikshna, and 106 is very high. So I told the doctor, why don't you change your thermometer and check with another thermometer? So that was also done, and it is still showing 106. And every day 106, it is not going down. And the 6th day morning, the doctor said, the child is having Atisaram, watery stools. Then this sloka saved us. I said, this is Nirama Avastha. Absolute. Child has hardly had any food. Totally Nirama. Shleshmam is gone. There is no more Shleshmam left in the body of the child. And it is only asking for water. I said, give milk. So the doctor said, the child is having Atisaram. I said, never mind. Give milk. That is what our Ashtanga says. The milk was given, and we have to believe it. The fever was resolved. Atisaram stopped. So that was a lesson to all of us. And since then, see, every avastha is described in our Jara Chikitsa. And this was definitely, this is an avastha we come across in the COVID patients sometimes. And very successfully, it resolves with introduction of Kshiram. Now, I remember another patient, COVID positive. He called and he said, Doctor, I am your very old patient. You may not remember me. Many years ago, I had come. Now I'm COVID positive. But he said, I have a headache as though my head would burst. He said, Thala vedikara mari irukku. That means burst. And I'm coming right now to get admitted. Save me. Now, okay, definitely COVID does. I mean, Shiro Parvaruk, all this is there, but it is not something that you start with headache as though it's going to break your head. So we asked him, I said, don't worry, what have you been doing? What is it? So we found out that he's almost following a vegan diet, no milk, no ghee, nothing. And then he has been buying in Tamil Nadu, there is what is called Kavasura Kudineer. And Kavasura Kudineer is nothing but it has all the ingredients that are there in Vidaria Digritam, plus 3 more, which is Vasa, Karpuravalli, and Tulasi. I think that makes it Kavasura Kudineer. So he said, I've been drinking this Kavasura Kudineer daily 2-3 times. So you see what has happened. Kavasura Kudineer is it's Ushnam Shleshmaharam. On top of that, he's not had any milk or milk product. He's not in the house. He's a vegetarian. So simply this has caused the problem. So we said, listen, you don't do anything. You stay right there. Put some he had no fever also. He put some Anutailam in your nostrils. Put Nirgundi Tailam on the head. And we gave him which Gritam, I forget, one of the Gritams. I said, and then you call us. And that really brought his intensity of the problem down. He said he was so relieved. So avastha is very, very important. We can't, just because a COVID patient thinks my head is going to burst, immediately we can't say this is an extreme case of COVID. We have been taught to examine every disease, and especially in Jwara, the Nidhanam is so important. Every avastha is so important. I think there is nothing more you can say about Jwara. Everything that has to be said is said in our text. So I hope that is some of the instances.
Okay, ma'am. So while treating these COVID,
sit to the mic.
While treating these COVID patients, what are the vital signs that you consider?
Vital signs.
Yes.
Actually, vital signs are for us. Okay, the routine things are what is the fever, what are the symptoms, lakshanas of the jwaram is there. Besides that, is the person oriented? Because that also Agni Balam of the patient, then Malamutra Visarjanam. These are the things we look at. In fact, we'd also, I mean, you see, we have been taught that asadhya lakshanas of a jwaram. So asadhya lakshana would be like Tikshna jwaram with pralapam, bhrama, shwasam, and Antarvegam. I mean, none of this. I mean, I don't think our COVID patients have any of these. So we basically check to find out if everything, what are the normal vital symptoms. But I know even in the case record form, there is a page where it asks for all kinds of details like pulse rate, heart rate, and things like that. Now, there is also, and of course, nowadays everybody wears this something on their finger. What is it called? Pulse oximeter. Pulse oximeter, which shows what is the oxygen level. So whether some of them provide you already what is their oxygen level and all that. So now I will give you an example of going. I think I have put it here. Yeah. Now, it is always safe to stick to our Ayurvedic texts if we are treating by Ayurveda. The vital signs that are given for modern Western medicine is meant for them. By looking at those and trying to treat here, we will only get confused. For example, I mean, this details I got because that patient was being looked after by daughter who had just arrived from Canada, who is a researcher in healthcare area. So she gave us a lot of information. So his CT scan score shows 25. Then it says bilateral diffuse reticular pulmonary interstitial thickening with multiple scattered ground glass opacities, patches, parenchymal infiltrates involving both upper lobes, right middle lobe, 50 to 55% lung involvement, bilateral diffuse mosaic pattern, attenuation involving both lung fields, fever 103, 104 Fahrenheit, and SpO2 dipping to 79-80. Now, if you say if it is score 25, now if it says score 18 is indicative of high mortality in short-term follow-up. This is what it says. Now, if 18 is going to indicate high mortality in short-term follow-up, why are we accepting 25? Then, of course, it has all these 55% lung involvement and all these lobes are involved and all these mosaic opacity, etc., etc. I do not understand what these are. And SpO2 level, it's anything less than 93, their antennas go up. Less than 90 definitely is a problem according to them. And 79, 80 definitely is a situation they would say it requires oxygen. Now, we decided our doctors, they were not concerned with all this. Of course, one information which we didn't have, which he told us later on, which I'll tell you later. He is oriented, he's all right, there is terrific weakness is there. He said that there is a constriction in the chest, not being able to cough. And there is some kind of a constriction, that is all. By no means it was not some heavy shwasam. And fever, of course, is 104. Now, usually 104 is a very unusual to see, because if I remember some 2-3 patients may be 104. 103 is also not that common. It's usually 102 and below. So we started the treatment. I brought his paper here just for reference. And you would like to see what medicines? Yeah, we gave him what is the medicines? Anyway, he is given, I think, Vidaria Digritam, Shwasakuttaras, Talisadi Churnam, Dhanvantara Guttika, Sudarshanam. Yeah, these were the medicines given to him, and also Tribonigittiras. I think, see if there is Shwasakuttaras are there. Now, what was the reason for? Now, you may consider this a severe condition. Now, the reason for this severity is which when the patient with the daughter visited us, he told us, we should be honest with you, doctor. We first went to allopathy when he had the fever and cough. He had, I think, cough. And they gave us a course of antibiotics at the hospital. We took it for 5 days or 6 days and it didn't go away. So we went back to the hospital, and the hospital pulmonologist gave a COVID test and it came COVID positive. After that, they said his condition is such that he has to be immediately hospitalized. And the doctor, being quite a smart person, she said she did not. She knew, of course, there is not much help in this system. So she wanted a private room for her father so that she could observe the father carefully. So they said there is no private room available. You would have to wait for 24 hours. Then they waited. Then the second day again, they said there's no room available. So they waited again. So by the time it came to Ayurvedic care, about 9-10 days have gone. And that is the reason why this patient is in this state. Not because it started out like that. So this is what I was trying to tell you, that mild and moderate cases, if not attended properly, if not treated, I would say treated properly or wrongly treated, it could be either, and it can deteriorate and become a severe case. So then anyway, that this patient had a routine follow-up. Of course, it was very, very worrying. Our doctors would, I watch our doctors with so much worry in their mind. They would call. First thing when they come, they say, we have to find out how this patient is. It is like that. Our doctors are every day worried about some patient or the other, because there is always some patient which is causing them worry. So this patient had, then at night it turned to 102 fever. Then he had a semi-solid motion. And then the next day, SpO2 dropped to again 79-80 was the second days. Then that this is very interesting. That lady said that when they gave, we gave, Tribhoni Kirti Rasa and Vetumaran Gutika are the same because they have the same ingredients. So Vetumaran Gutika, when she gave at 4:30 in the morning, although we had not asked her to give it at 4:30 a.m., but they are all up, I think. She said the SpO2 jumped to 92. Now, anyway, this doesn't make any difference to us, but I'm just incidentally, because it is written here, I mentioned it. Now, at 11:30 a.m., when our doctor called, that patient is stable, but sleeplessness was the major complaint, unable to cough freely, feels obstruction in the chest. Then we, at that time, we had added Swasagutta Ras. Until then, we had not added Swasagutta Ras. So that day, 6 hourly 3 tab 111 was added along with some Kanakasava. Then the next day, there is no fever. That was the fourth day. And SpO2 level is 89 to 93. There is loss of appetite, chest obstruction persists, not able to sleep. Then milk and ghee was introduced. And the next day, there is a mild fever of 100.4. And SpO2 shows 80s, and especially when he goes to urinate or when he wants to pass stools, that time he said every time the SpO2 drops. Then he's feeling better, then wants to cough, unable to cough. This is even on the 5th day. Then on the 6th day, no fever since today morning. Then SpO2 is around 90, and then bowel movement. Then after that, it picks up to 95, 96, and then it goes on. Mild Shwasam present, it's written on the 7th day. Then Vidaria Digritam, Ashwagandha Churanam, etc. were being given. Anyway, as you can see, they had followed it up to 14th day, so that they made very sure that SpO2 constant at 95, 96, no constriction at all in the chest, sleeplessness present. This was the report sent to us by email. And then 2 days ago, the two daughters with the father had come to do, they did a Sashtanga Namaskaram and said, My father is, even now he doesn't know that he has COVID, because just the thought that he had COVID would be very frightening, and he's a very sensitive person. So that man was a lucky man. He had 2 good daughters looking after him. None, he went through all this without knowing he had COVID. Anyway, so something we gave for his sleep, other thing, and so this was the this is why I said this is, if you start monitoring any chikitsa for that matter, I mean, in terms of, it is different if they had undergone a surgery, that you should be aware some organs are missing in their body. It is not like that. In diseases like this, in Jwara Chikitsa, if we start wondering what is the oxygen level and what is the lung involvement, what is it showing in the X-ray, what is it showing in the CT scan, and then we start interpreting these and to decide, and that if they have a bearing on our treatment, then we would never be able to treat confidently, relying on our texts and our theory with respect to COVID-19 I'm now talking about. So this is, I brought this out only to make this point. This is a point which we again and again, when young doctors come to us for training or come to us to work, this is one thing we insist, that you go by our parameters, you go by our vital signs. These signs are there, it's all discussed in our books, sadhya, asadhya, every possible thing is discussed. Go by that, and don't get influenced by these kind of x-rays and other things. So this is regarding the vital signs.
Okay, ma'am. Surely, many a times these kind of modern parameters do misguide us in planning the treatment also. Ma'am, how do you understand the different manifestations of COVID in terms of samprapti?
Doctor, for us, there is only one samprapti, which is Jwara samprapti. That is mityahara viharabhyam doshahi asrayaha. We know, everybody knows this. Bahir nirasya koshtaginim jwaradaha su prasanugaha is the sloka, which we know. There is no different samprapti in COVID. There are different avasthas in COVID. There is different avastha in the sense, as I mentioned, there are, depending on the situation, there's only avastha. There is no samprapti is not different.
Okay, ma'am. What is your opinion about curability of severe and critical cases of COVID-19 with Ayurveda? Curability of severe and critical.
Now, I have put here, I unfortunately you can't see the thing. Severe and critical or vulnerable, there is already a group of diseases that are given. Out of that, chronic kidney disease is one of them. Then chronic obstructive pulmonary disease, COPD. Then cancer, diabetes, then chronic cardiac disease, then hypertension, tuberculosis, asthma, then chronic liver diseases, chronic neurological disorders, then BMI about 30 and above, old age, and immunocompromised. These are the ones that are given. Now, yes, this more or less in most of the category, we've had patients. We've had patients of kidney disorders with multiple comorbidities, and then COPD we've had, cancer we've had 3 of them, diabetes we've had plenty, cardiac disease we've had, people who've been not current tuberculosis but recently treated tuberculosis, but that doesn't matter. The currently TB we didn't have. Then asthma, yes, and BMI definitely, and then immunocompromised, yes, and old age, yes. If you want, if there is time, I can look at some of these. I don't know how the time factor is, but some of these, maybe 2-3 of them, if they are interested in knowing how exactly we went about it, I can look at it. You let me know about the time.
Okay.
Should I?
Ramana,
Time is not a constraint from our side. Time is.
All right. Okay. Now, the reason why I wanted you to see is to show there is nothing fantastic about it. I mean, we've not done something which is so which is so uncommon that we save them. We just have to go systematically with Jwara Chikitsa. Now, the first one was it is yes, the first person was a chronic kidney disease. So 3 times dialysis in a week. So which means every other day she's having a dialysis for 10 years. Now she has all possible comorbidities also. She's a chronic kidney disease. She's a diabetic on insulin. That also for 10 years. Then she has a lesion in a tumor in her breast. Then she is hypertensive. She's a cardiac patient. And she had one more problem. I forget. Anyway. And on top of this, she is a COVID positive. So you see, she has all possible comorbidities. The reason why she was referred to us is that they felt that Ayurvedic treatment would be safe for her. She would not tolerate any strong medicine. So she was sent to Ayurveda, to our care. And now what is it that we should think of? She has COVID. What are the symptoms? She had a fever for a short while. On the day she went for dialysis, they tested and found her COVID positive, so they refused treatment for her. And then after that, when she came, she had no fever. She didn't come. The person who came on her behalf, cough 4-5 times a day. Bowel movement was semi-solid, and she always had this problem. A semi-solid bowel is one of the problems also she has. So we decided then the best thing for her would be Pipilyadi Churnam, because she being a diabetic. Pipilyadi Churnam is from Sarangadara Samhita. It has Pipali and Triphala, nothing more than that. So Pipilyadi Churnam, half teaspoon 3 times a day in honey, Dhanvantara Gutika, Sudarshanam, and after food we gave Kutajarishtam. What she felt best was, she said that Kutajarishtam, when I had, it gave me a lot of life, she said. That was something she felt very good with. Then the next morning she had next morning she had no fever, but by evening she had 100.4. She continued the same medicine. Then again, feeling of heaviness, low urine output. Naturally, somebody who's on dialysis will have not high urine output. Bowel still semi-solid. Appetite was normal. There was a 1 kg weight gain. Now, dialysis patients, if they don't do hemodialysis, the weight keeps going up. So then we introduced, because there was some fever, we introduced Barangyadi Kashayam and Gokshura water given for drinking. That was all there was to it, her treatment. Then a watery stool continued, urine output had slightly increased, cough only when she was lying down, otherwise the cough was largely resolved. And so then we advised her to stop Pipilyadi Churnam because it is also Bhedini. So she was already having semi-solid motion, so we stopped that. And we continued with the rest, Gokshura water and some Darimashtra Churnam and Dhanvantara Gutika. So it beyond this, we did not add any more medication. What was interesting, she did not gain much weight because she was on a very strict diet. Usually, there is no control in their diet. They'll be having Tair Sadam, they'll be having Tair Sadam by itself, curd rice. Yeah. And there is absolute. So, being only on some mung dal and parboiled rice and nothing more than that, she did not gain much weight. There was not much discomfort. And 8 days she had not had, because in 7 days she would have 3 hemodialysis. 8 days continuously she had had no dialysis. Anyway, by then they managed to find a hospital which would admit her in the ICU, and then they went on with the hemodialysis but gave no medication for her COVID. And on 13th or 14th day, she becomes COVID negative. By then, the hemodialysis also gave her a lot of comfort. And so that was so. You see, this is not just kidney disease alone. She has every possible comorbidity. More than half of the comorbidities listed in here. Then there was another case of this is again a oncologist who referred, who was also a lung cancer which had spread to bone and things like that. And again, this patient was in the middle of chemotherapy. So chemotherapy, I suppose, is it's a compromised immunity. So this was one of the cases, and in this case, it was almost asymptomatic, more or less. So we gave ashwagandha churnam in milk, Indukanda Gritam, Guduchi Kashayam, and Sudarshan. So in less than I think in 5 days, 4 days, I think his symptoms were resolved. Very mild symptoms and no fever. And then there was this case of another cancer whose that cancer patient is I think I took down some notes here. Yeah, she is diabetic mellitus for 10 years on insulin. Then she's hypertensive for 10 years. She had cancer in the breast, 4 chemotherapies she underwent. Then she had a surgery to remove her breast, and then she had 4 more chemotherapy and 10 radiation when she went in with the COVID positive. Now, the symptoms she had was she had fever, not very high, mild. And then this was an interesting case where, of course, we gave Varingyadi, Talisadi, Sudarshan, Dhanvantaram, and Vettumaran. And sometimes what we do, we will tell them, don't use this. We give a packet of all these medicines and say, use these medicines. Sometimes we say, wait and don't use these medicines. So we are sort of trying to take care of all eventualities, that at any point of time they need to use a medicine, then they will use it. So in this was her kit, and then this fever persisted, and then at one point the fever went away. But then again, that fever kind of reappeared, 101 fever, and by then it is day 8. Then we felt that this is something which is like Jirna Jwaram, but 101 fever, we sort of hesitated. We again went on with the medication, and then she kept telling us, I feel very, very well, but only the thermometer is showing 101, 100, 101. I don't feel feverish. So we said, okay, fine, you start on milk and some ghee in diet. And then we started her on Indukanda Gritam, and there everything ended. She was perfectly all right. So it was, kafe mande vata vittotere jware. So that was the condition, which we delayed it by a few days, being a little worried. So that was another case. And then there was that COPD. That was another interesting case. That over here I had that. Yeah, COPD was 67 years old. When he came, he had cough, vomiting, loose motion, nausea. These were the symptoms. And he was a heart patient. So this again, we were worried. We thought for a while, being already a COVID patient, sometimes he uses oxygen in the house, and whatever the inhaler in the house. So should we take it or not? Then anyway, we looked at that. Was very strange. We usually tell them don't come in person, but he came in person with his son and daughter. So we could do nothing about it. We made them sit outside, and then we said that man looked well-built, stocky, yes, elderly, and but he didn't look like he had only this whatever said COPD and other things, but he looked quite fine to us. So we said, okay, we'll take it. And his he had also that oxygen monitoring meter with him. So we started treatment, and he became very weak at third day because that vomiting and nausea and vomiting, and that had made him very weak. But he responded very well to the medication, and at one point it dropped to 88, the SpO2, and after that, anyway, his family was very worried. So in 4-5 days he was very well. Then anyway, they took him to a allopathic hospital and for observation. And he said, by the time I went to the hospital, I was 90% all right. So and then their test, everything, it didn't show any. It shows that COVID had resolved, and they kept him there for a few days, 3-4 days, and he was fine. And he came back home, and he came to our clinic, and then he said, he told our doctors that thank you so much, because of you I'm saved. In the intervening period, my mother and my sister died of COVID. You saved me. Now this is these are some of the cases which then of course we had for old age is also supposed to be a worrying condition. So we've had a 92-year-old man, again, loose motion, 1 week of loose motion, 6 to 7 times a day is enough to make an old man really very weak. He's already a cardiac patient, and he was on hypertension, a medication for hypertension, and a recent history of tuberculosis. Anyway, that was also a manageable condition. It was managed just the same way, and like very same medicines that I had told you all this while, some of them, maybe the adimashram and a few others. So he had very mild fever, I think. So we comorbidities, we had something like, I think, 41% among, if you look at the total numbers. And even this BMI 30 and above was said to be problematic. We had a BMI which said 40. So just about every comorbidity can be very well addressed based strictly on our Ayurvedic theory and practice. And I don't think it's okay if you want to measure. People who are interested, who are I think intellectually very curious, what is the type of lung condition X-ray would show. There are a lot of very bright people. I really don't understand Western medicine, so I don't look at that because I'm not trained to look at that. But there are people who understand it also, even Ayurveda people. I often ask my colleagues, what does this mean? What does that mean? They only tell me, doctor, it means this, it means that. Now, if you want to strictly go by Ayurveda, we have more than well equipped. But if you are also curious to know what does it show, what does something else show, you are welcome to do that. But please let that not have a bearing on your treatment. For treatment, you please stick to Ayurveda, and that only will give us confidence also. If we start looking at the other system, and according to them, there are many things which are critical, then we have to independently decide what is critical for us. All right. So that is about conditions, about critical and vulnerable.
Thank you, ma'am. Another question to you is, are you advising diet and lifestyle? Are you advising diet and lifestyle along with medicines to your patients?
Yes. We can't treat without diet and lifestyle. And, that whole thing is there, that Vidahi Annam, Guru Annam, Asatmi Annam, Viruddha Annam, everything is a Vyayamam, Vyavayam. Chankramanam, Snanam, Abhyangam, Divasopnam. All this is routine. We just give it in, we give a printed sheet in which all this is written. That, of course, they had stand no chance. We give nothing beyond Purungalarsi Kanji Varcha Sadam, which is just Odanam with a little liquid Mudga soup. That's it. Nothing beyond that. So by 3 days, third day, people are crying. Some of them actually, my doctors say, doctor, this child, this person is crying. I know why they are crying. Their coffee is not there, their tea is not there, Tide Sadam is not there. You see, they're just being asked to eat this, but then they are mortally scared. They said, okay, we will swallow anything as long as we can get out of this COVID. But unfortunately, there is so much build-up about this COVID because of the fact that the mainstream medicine does not have a treatment for it. So this fear, and I feel it's a great regret for me that Kerala has such eminent Vaidyas, and every kugrama will have an eminent Vaidya. Why they don't allow the Kerala Vaidyas, they don't allow them to treat COVID? It is just it's a very very sad story. I think the Vaidyas of Kerala should definitely. I think this is the time for you to stand up and make some statement to your government.
No, ma'am. That is an unfortunate part from the God's own country. Okay. Anyway, we
Looks
are
like Dhanvantri
doing
is
some
not your
efforts in
god.
this.
Huh? Dhanvantri should be your god,
Ma'am, are you treating patients admitted in allopathic hospitals?
No, I don't.
Okay. Do you tell your patients to stop medications that they are taking for their comorbidities like diabetes or hypertension, etc.?
No, I don't.
While you treat,
No,
so
I
they
don't.
will be allowed to continue the medication.
Yeah, if they're taking some unnecessary medicines, then we tell them please stop. They sometimes take some
Yes.
supplements which are all which are all quite useless in our point of view. So we may tell them please stop these. But primarily, you see, in fact, 99.9% of the time they are not our patients. Our routine, our patients who are who are used to taking Ayurvedic medicine, they are all first time patients. In between, I think I saw only one or two of our patients, but and they have come only for COVID. They have not come to address, they don't want you to address any other problem of theirs. So we get them out of this problem, and after that they are not going to come back to us either. Some of them may, but most of them won't. They would go back to their caretaker, treating physicians. That's it.
So, are you administering Ayurvedic medicines along with the allopathic treatments? If the patient is undergoing allopathic treatments, and whether you are suggesting some Ayurvedic medicines?
I thought I answered that question just now.
Okay, no, ma'am.
Yes,
If the patient is undergoing some.
Tell me, please.
Okay. No, if the patient is undergoing some allopathic procedures and all, treatment procedures.
No procedure is done while they are having COVID. They discontinue all procedures and they tell you come back when you're COVID negative.
Okay. Do you consider referring patients to an allopathic hospital at any point of time during your treatment?
You heard me all this while. You tell me not a single patient deteriorates in Ayurvedic treatment. So from our side, there is not a need for a referral.
Okay, that's great. It gives a lot of confidence also. How many patients have you treated, and what is the outcome?
We must be nearing around roughly around, I think now we are around 140, I think. About 130, it's all been files have been put aside. And maybe currently ongoing would be close to 10. So outcome is only good outcome. I mean, Vata Kapha Jwaram, all of you have treated. Who has not treated? You tell me. What is there any different medicine that we have used which is beyond you? So it is just that I mean, some of you did not get a chance to treat. Doesn't mean you are not. I mean, there is something altogether new in this. Just a Vata Kapha Jwaram, which can be eminently treated. In fact, very, very unnecessary deaths have happened, so much of deaths. You see, there has been not a single case of death or deterioration. So, unless it is, I mean, it is, we could have saved a lot of people if this COVID has been handed over to Ayush systems. Even now, it's not too late. COVID is not over today, tomorrow. It's going to go on for some more time. So I suppose somewhere along the line, we have to keep talking. We have to keep addressing all possible platforms that we get. Just because you have not treated doesn't mean you cannot talk confidently. Your colleagues are treating. We are all treating. We are all your colleagues. You know what we are doing. Everything we have told you. Definitely, you can speak with confidence and tell them that people are treating and this is to be handled. It is okay, safe, distancing, etc. All this is fine, necessary, but just hand it over to Ayush systems. Okay, sir.
Okay.
Any
Another one more question. Now, what do you think is the greatest benefits from Ayurveda treatment for COVID-19?
that is that our patients survive. They don't have to die. The death rate would have been such a minuscule if we had, if Ayush systems had handled. The resolution of symptom is very quick because we are giving, Bahukalpam, Bahugunam, Sampannam, Yogyam, Aushadam is, we have such fantastic medicines. And not one and two. It is not like we are going to find one medicine. If my teacher used to say that, if, Girija, your medicines are not important. You go and chuck all this medicine to Bay of Bengal. Still, you should be able to treat with things which are in your kitchen. COVID-19 is one such. You can treat them with things in your kitchen, and whatever is in the surrounding, you will be able to pick up things. So the I mean people would have benefited a lot. It would have cost the exchequer much less. Expenses would have been very little. It would have been all a very different story, but that didn't happen.
Ma'am, are you giving medicines for prevention of COVID-19?
See, for
If
prevention,
the family member is having COVID.
yeah, I'll tell you, for prevention, what we do is, you see, the clinic is actually quite busy. So we tell whoever calls for prevention, we tell them, go to our website and check, it is there. So they can look at our website and follow whatever is there. So otherwise, we just tell them on the phone, we just gargle with Triphala and use some Anutailam and avoid certain kind of food. So and prevention, it works very well because one of our colleagues, she had her husband with 104 fever, COVID, and son also had fever, but she didn't get it because in our Vaidyashala, she was regularly given Guruji Kashayam to Sudarshana tablet. So she didn't get it. Her son and husband got it. So that is when all our staff really became very ushar. Our therapists, they said, so this really works, they thought. I mean, they of course knew, but this really gave them a lot of more moral boost that, it saved our staff. from getting infected. Anything else, sir?
Yes, ma'am. Are you giving treatment for rehabilitation after recovery from COVID-19?
That's something which I miss saying. Definitely, we tell them they come for the first prescription. Then, after the resolution of symptom, we tell them to come for a second prescription, where we introduce rasayanam and other kind of medicine, which is used for convalescing. So that definitely is there.
Okay, ma'am. And another question, are you planning to publish more research papers based on your clinical experience in managing COVID-19? What
Yes,
is
we
your
are.
plans?
Yes, we are. This is, I should say, in Sanjeevani, none of our doctors think of publishing. And the first thing was published because it was as early as February when we had just started the task force. And that time, this case we had treated, and it was Professor Bhushan Patwardhan who suggested we publish it. So we wrote in, this is probably our first one we published. Then after that, also we didn't think of publishing as such, but then I should say Dr. Ram Manohar and Dr. Girish Dillu, they've been very, very supportive and encouraging. So they said it is, so I think from some inspiration from them, we thought, okay, we will again publish. So we thought of writing two papers, one on case series on comorbidities, because it is usually assumed the so-called mild and moderate alone are the ones that Ayurveda people are treating. So when it comes to serious cases, that it cannot be. So just to sort of to sort of puncture that kind of a opinion, we thought we will put together some 5 or 6 cases that we are doing. Then the other one is we thought, which is I feel is more important, is the observational maybe study of maybe I don't know how many will be there, maybe 130 patients or whatever number of patients we have now, we'll put together and also give it for publishing. So I would say we've been encouraged particularly by these two doctors who are into publishing, and definitely we will publish it.
Yes, ma'am. Eagerly waiting. Ma'am, in your patients, how do you manage the stress factors? How do you manage the stress factors in your patients?
That's simply hand holding them morning till evening. Some of them cry on the phone, some of them, they're all, we just have to go on repeatedly say, first of all, we have to tell them, this will give you a good result, don't drop out. Follow the diet, whatever it may be. Then keep on, they have so many doubts, I can tell you, they will call you 100 times a day, asking them, can I take this, can I take that? So literally you have to handhold them right through till the resolution of symptom. That is that there is a stress, because one of our patients said, I'm very confident it will work, but when I read the newspapers, it worries me. See what is going on outside and the kind of death they are seeing. He said that is what is worrying, not that I don't have confidence in the medicine. So this is expected, and I suppose media constantly harping. They have turned a diplomatic blind eye towards Ayurveda. No English paper. I think Tamil papers and Tamil media has done far better. They probably taken the decision that we have to give positive inputs, and they have been saying Siddha medicines, Ayurveda medicines. They have covered a lot. Whereas if you look at the English newspapers, tell me one English newspaper has written, they are supposed to do investigative journalism. What investigation have they done? They've done nothing. So they've just ducked this whole thing, and they are waiting for the day that vaccine is going to arrive.
Okay, ma'am. There are a few questions related with the yogas. Shall I ask that? Some of the yogas like Vyagrati Kashayam, Bhargyadi Kashayam, Dashamula Kadutrayam Kashayam, Elakanadi, Balaji Ragadi Kashayams. In which kind of manifestations do you prefer these Kashayams?
All kashayams are good.
Ma'am, is it audible?
Yeah, I can
Okay.
hear you very well. Doctor, all kashayams are good kashayams. All medicines are good medicines. You have to stop it somewhere. Now, if you take Vyagriyadi, after Vyagriyadi comes that Kustumbaradi. What is Patya Kustumbaradi Kashayam? It has a better Falasruti if you look at it. But Vyagriyadi is enough. It has everything that is required. So, Vyagriyadi Kashayam is Vyagri, Shunti, Amrita, and then with Pipili Churna Samyuta. So, we can make it ourselves very quickly. See, it has to be something we can also make easily at our Vaidyashala. So we choose, and then you see, Vata Sleshma Jara, Shwasa, Kasa, Penasa, Shulajit. Now, this is enough for us. Similarly, Barangyadi, just about everything, Jwaram, Santatam, Satatam, Anyadushkam, Tritiyakam, Chaturtakam, everything is there. So and then we get we also have Dashamalagadtrayam for people, I mean, without Jwaram, but they also have
I think the signal is breaking.
There is a signal problem from Madam's side.
Hello.
Yeah.
You could hear me?
Yes, ma'am.
Till you heard Dashamalagadtrayam, right?
Yes.
Hello. Yeah. So,
Yes, ma'am. Yes, ma'am.
So we have these three kashayams, and we keep guduchi because guduchi is tridosha haram. Then guduchi is also good for, besides dosha trayabham, it has trid, daha, moha, kasa, everything is there. Kamala, kushta, vata, jwara, everything is there. So wherever we want to use, we'll use guduchi, and then otherwise we manage with these three kashayams. So we don't use anything as far as concerned, we manage with these four only, and I'm quite confident in future also we can manage with these four, unless for some reason we may require anything else, we would look out for other kashayams. So we have found that this was more than sufficient. Anything else? You could hear me?
Similarly, yes, ma'am. Yes, ma'am. Similarly, the churnams like Talisadi churnam, Sitopaladi, Trikatu, Hingojadi, Vaishwanaram, Sudarshanam. Can you give some inputs on these churnams where it can be?
Definitely, they're all excellent churnams. We use just talisadi as mostly talisadi. Sitophaladi
Okay.
we have not been using because Sitophaladi in the Falasruti, if you see, it is not Jwaraharam. It has other things used. It's very useful. It is not Jwaraharam, and it has to be used with Gritam also. Gritam and Chaudaram. So in a Jwara condition and in in an ama condition, our preference is definitely for Tali Sadi because it's Shwasam Kasam Valchi Haram, Tachurnam Deepanam Param, Hrit Pandu Grahani Dosham, everything is there, Sosha Pliha Jorabaham. Then Vami Atisara Shulagnam Mudhavata Anuromana. So these are the ones which will be more relevant for us than Sitopaladi there. So like that, similarly, Pipili, Triphala Pipili Churnam, the reason why we took it is because diabetes is very widely, it's very prevalent, and Talisadi and all has a lot of sugar. You see, those days they were not using this sugar. Nowadays we are just using plain sugar. So it is safer because Triphala and Pipali is safer to be given to a Prameha patient. So we took that, and it is also Kasa Swasa Jwarahari Triphala Pipali Yuta. Then Churnita Madhuna Lida Vedini Cha Agnibodhini. It is Vedini and Agnibodhini. So it's a very interesting Churnam and is very, very useful. Then we have Sudarshan. I don't need to tell you about Sudarshan. It has just about everything you can think of. Besides, although it's used so much in Jwaram, we very often use, see, Trika Prishta Kati Janu Parshvashula Nivaranam. So very often people who come with pain in Trika Prishta Kati Janu and Parshvam, it's a very, very useful medicine. And just about all jwaras, and it has also a wide Swasam, Kasam, Pandu, Hridrogam, Kamala, everything. Now, the only instruction that we need to remember about Sudarshanam is Shitabana Pivet Dhiman. So that is when Sudarshana Churnam should be always taken with Shitambu. So we tell them boiled and cooled water. Very often, everything we give it in hot water. People tend to take Sudarshanam also in hot water. So we always have to specifically tell them that it should be accompanied, Anupanam should be Shitambu and not hot water. So then there is Danimashta Churnam, we all know. This is again Ashwagandhadi Churnam. It's an excellent Churnam. It is very similar to Tali Sadi. Instead, it has Ashwagandha in large proportion. Vatagnam, Pandu, Gulma, Shaya, Gudajo, Arochaka, Ajirna Shulan, Kasam, Parshvotta Shulam, Hridaya, Galagadam, Sutika Roga, Mehan, Grandi, Shwasam, Cha Hikkam, Jwara Haram. This much is the Falashruti. So it's a very, very useful medicine. So this is, it is also Sleshmahari, Krimignam. So it has other properties also. So this is a very good churnam. So these are the churnams. We managed with this many churnam. Tali Sadi, Danimashtakam, Triphala Pipali, and Ashwagandhadi. I think, and Sudarshanam. This is the only thing we use.
Sudarshan. Okay. Three more questions I have. I think shall we proceed? Okay.
Yes, please.
Okay. In which conditions you give gutikas like Villuadi Gutika, Dhanvantaram, Niruryadi, Shwasanandam, Lakshmi Vilas, Tribhuna Kirti?
As I told you, Tribhuvana Kirti and Vetumaran are the same. And usually in our practice, we don't use it so much. In COVID, initially, as I told you, a lot of build-up was from the media, so we had listed it, and so we have been using that. But Mahalakshmi Vilas Ras and all that, I would use it it's an excellent medicine. We do use it, but in more chronic conditions we use. Long-standing fevers, I find it very much more useful. Then what are the other medicines you asked?
Villuadi Gutika.
Villuadi Gutika, Vilvasya Moolam, Sarasasya. Okay. So that is the Falashruti, if you look at it, in that it is because it was thought that it was Vishajanyam that Vilvadi came into discussion. Otherwise, in Vishuchika kind of condition, I would probably opt for Vilvadi because there is Chardi and Atisaram together. Otherwise, it may be somebody who has some better experience in using may use it. I don't know, but we don't use it here. Other than that,
Dhanvantaram Gutika.
Dhanvantara Gutika, I don't need to tell you Dhanvantara Gutika. It has again, you have everything there. Yakshmana, then it has Hikka, Chardi. Chardi is, so often we have come across Chardi also. So it is there for Hikka, Chardi, then Kapha Prasekam. It has a lot of, and also Jwaram. So that is a very good, we in all our Jwara Chikitsa, Dhanvantara Gutika will be there. So that is a very useful medicine. Then other than this,
Okay,
let
ma'am.
me see what are the Gutika we use. That is all the Gutikas we have used. Dhanvantara Gutika. Yes.
Anandam.
No, Shwasakuta Ras we have used. Shwasakuta Ras again is
Okay.
yeah, Shwasaka Sajit and Pratishyaya, Shatachena, everything is there, Hridroga, Parfashula. So it's again a very good medicine, very effective medicine. Sometimes Shwasakuta Ras is given with Kanakaswam, it works very well. If there is a, especially if it is Kapha Pradhanyam. So it's a very, very useful medicine in a condition where there is Shwasam, Kasam, all this. Shwasam, Kasam, and Sannipatam, everything is there. Tandaram, then Praveham, all kinds of, it has a very interesting Phalashruti. So that's a very useful medicine we have. Other than that, what else? I think that's all the tablets I can think of. Nothing else we used.
Okay, ma'am. Arishtams, in Arishtam, other than Kanakasam, like Pipalyasavam, Dashamula Arishtam, Balarishtam, Amrita Arishtam.
We used 4 Arishtams. Dashamula Arishtam. Then sometimes, yeah, we even had a child, I think 2.5 years old. So in so Vasarishtam or Amritarishtam, one of them we use for a child and young children kind of. Otherwise, it is there, but we didn't use it as such. But we did in very rare case Vasarishtam, and Vasarishtam is a very good Arishtam. It says Vividan Rogan Jayetashu. So even they, I mean, they are also clueless how many it can cure very many diseases. Kasam, Shwasam, everything, Raktavittam, it's a very good Arishtam which we have used. And Amrita Arishtam also rarely, maybe in some youngsters we have used. Then Dashamula Arishtam, we used just about for most people during convalescence. Dashamula Arishtam is one of the Arishtams we have given. And you know, Dashamula Arishtam again has a Phalashruti which is all the 30 chapters of Ashtanga Hridayam, it will be there. All the Phalashruti it has. So it is a very good Arishtam. So we use that. Other than that, any other question?
Okay, ma'am.
About Gritams, huh? Is that about Gritams? Yeah, the Gritams that we use.
Yes, ma'am.
One of them very, very commonly used at Sanjeevani is Darimadi Gritam. So it is Hrit Pandu Gulma Atta Pliha Vata Kafartinut. Then of course Deepanam Shwasa Kasagnam Udhavata Anulomanam Dukha Prasavinamcha Vandhyanamcha Prasasyate, all that we know. So this is an excellent Gritam which we have been using. And a lot of people are also Pandu, so it is a very, very useful Gritam. Then the other one is Vidaria Digritam, Indugandha Gritam, which I think Kerala people are very familiar with Indugandha Gritam. And this Amrita Prasagritam again has a wonderful Phalashruti, Amrita Prasagritam. So that again is in the convalescence, it can be used very effectively. And sometimes some of them are vegetarian, so we tell them, do you mind if we give you we put it like this. We don't say meat in it and all that. So we tell them, because people have a habit of going into net and getting into the ingredients. So we tell them, yes, it may have an extract of animal protein. So they are very happy to hear that. Doesn't matter, doctor, you give it to us. So I find increasingly people are accepting the fact medicines are meant to do its job, whether it is plant origin or animal origin. It is not a problem. So we give Amrita Prasham also. So it has been, these are the medicines. I don't think we use anything beyond this. We have managed all the patients within this list of medicines that you have seen.
Okay, ma'am. Okay, ma'am. And the final question: at any point of time, whether you have thought of doing any procedures like any Sadyomana, Virechana, or any kind of Vasti?
Yeah, there is. See, actually, Vamanam has to be right at the beginning.
Yes.
So that stage, by they go for a COVID test and they come back. By the time the results comes, already 3 days are gone. That is beyond Vamana stage. Then Virechanam, no, but Vasti as such, no, not really. But sometimes
Okay.
we tell them to do some Rasanadi Churnam format. Yes, Rasanadi Churnam is something which I missed and you have also missed. That is a very useful
Yes.
thing which they tell them. Sometimes they say headache, we say we put a lepam with Rasanadi on the forehead. Sometimes we tell them do a steam inhalation with Rasanadi. And so that kind of, and then if there is no jwaram, Anutailam. So steam inhalation, Swedanam is the thing which we have quite often we have instructed to patients. Other than this, no, Vasti and all, no, we have not had a need for any of this.
Okay, ma'am. Okay, ma'am. Thank you. Thank you, ma'am. There are certain few questions from audience from the Facebook and YouTube as comments. So Dr. Ramanohar sir will be displaying that. Anyway, I'll read once again.
Like, if you face any kind of
Ma'am,
opposition from other system,
would you like to know if you face any kind of opposition at any stage from other medical system, authorities, etc., in your place while handling COVID positive patients? Asked by Rahul Vijay.
Authorities and medical system. Medical system, we have not. As far as I can see, there have been quite a lot of Western medical practitioners who've been very friendly and who've been very helpful. They've been in touch with us. They've been very encouraging. They have told us that we have no medicine. I'm so glad you are doing this. So others are just not. I mean, see, there are of course some diehard practitioners. They only know their system and they are not aware of any other system, and they think it is not evidence based. All kinds of assumptions you have. So, and since they don't have anything, I have not found any opposition from any other medical system. Authorities also, we face no difficulty, because you see, we are not advertising, we are not doing anything. Patients are coming to us. Patients have always come to us for Jwara Chikitsa. Patients are coming to us for Jwara Chikitsa even now. In Tamil Nadu, of course, they have understood, even though they are not. I happen to know one of the persons. He was is connected with the Planning Commission vice chairman. So I asked him, why is it that we are still talking about prevention and not cure, because we have found that it is curing. The answer that was given to me, it is a worldwide understanding that we don't speak about cure for COVID. So you see, this is the kind of answers we get, but we did not find any opposition. Treatment protocol, whether to refer the patient. Just now I finished telling you how we treated below oxygen saturation level 90. I gave you an example of
What will
79.
be the treatment protocol?
You see, we need to see. We don't worry about oxygen saturation level. This is what I gave you an example at length. How we ought not to
Yes,
look
sir.
at this. We independently assess whether there is Shwasam, Kasam, whatever it is, and then we treat. And the very same medicines you can treat them. How do you manage?
Okay, another question by others. How did you manage to get permission to treat COVID patients so that all Ayush practitioners would follow the same approach?
We didn't ask anybody for permission. We treated.
Okay.
Somebody
But in
else.
Kerala scenario is different. That is the thing.
No. Initially, we were told by some well-wishers who are in the Ayurvedic field that this is legally it is wrong. You know this. You would be facing problem and all that. But what did we do? We only treated. Patient came to us. We treated. So that's it. After that, that's it. And anyway, it is over the phone. There, you know that it's on the phone. We do all the case.
Okay.
I don't know. A lot of people were a little afraid, but we thought we will face it when it comes. And anyway, we had no difficulty.
Okay, ma'am. Ramano sir, is there any further questions in the?
Now we would like, because our medical director and principal has come. He couldn't come in the beginning because of so I would like to request him to address.
Unmute. Namaste, madam.
Namaste, sir. Namaste.
Namaste. Actually, unexpectedly, I had to. I could not come at the time I committed for this program. I met my guru, Mother Amrita Devi. So, but I listened for the past 45-50 minutes. It's a tremendous value that you are sharing this to those who are following this particular seminar, particular meeting. Even though we are not able to directly treat the patients, we are able, at least we are able to appreciate and understand that the pure Ayurveda can be still practiced. And I liked that, we don't have to confuse with the other ideas. We can treat with our own principles. Especially, I attended a seminar in Delhi. There one question was asked about, there was a discussion about giving milk in Jara. Then Dr. Gopakumar or somebody quoted this particular slogan, Kshiram Pittanilartasya Pathyama Patisarina. But one fellow from audience suddenly stood up and told that, have you ever given milk in fever? Today, I can say that at least you have given milk to a person who was having diarrhea. So it's a very interesting, to properly interpret and treat the patients with the pure Ayurvedic principles. I'm happy that nearly more than 140 patients have been directly treated. COVID patients have been treated and their family has been taken care. Many inputs were very useful, when the patient discusses his problems. Doctors, they tend to become irritable and they do not attend the phones properly. They do not think that it is their responsibility to handhold them. Nowadays, it is not the way that is being practiced. We are. I will definitely say that we have become more mercenaries, and these are all lessons to be learned from you. So I hope all those who listen to your talk would have noted all these things. So I'm very thankful on behalf of Amrita School of Ayurveda, and I pray to Amma that she might bless you with a long life and happiness, eternal happiness. Thank you very much.
Thank you, madam. I think we have troubled you for nearly 2 hours. So you have been very patient with all the questions. We have also kept you away from your patients. So I will now request Dr. Sharma. I hope you have completed your questions. Shall we go to the last part of the event?
Yes, sure, sir.
So I would now like to request Dr. Tripathi is not seen. We were just waiting for him to join. Just a moment. Yes. So I would now like to request Dr. Tripathi to say the concluding remarks.
Om Amruteshwari Namah. So, respected dignitaries and our most valued invited guest, Dr. PLT Girija, ladies and gentlemen, my dear colleagues and students, those who are attending this session. So, it was a very wonderful session, and Madam has answered all the questions that has been previously arranged and previously managed to ask her. Simultaneously, whatever the questions asked by the audience also addressed by Madam. So, from the Ayurvedic perspective, if we are thinking about COVID-19 and whatever Madam has explained here, definitely it's a Bhatakafaja Jwara which is having Pitanubandha. So, altogether we can tell that it's a Sannipadaja Jwara, and so many different treatment protocols has been mentioned in our text to manage it. And one thing I learned here also, when a patient is coming without any sign and symptom, Madam is categorizing that patient into Santarpana and Apatarpana. In that manner, she is managing whatever the patients are coming asymptomatic. Even though Ayush department has propagated so many medicines for the immunomodulator, but still when the patient is coming, we have to think according to our logic and we have to find out our own rationality to treat the patient. So that is a very good thing I learned from Madam. Simultaneously, it is also very much essential to manage the stress factor, because whenever a patient is getting positive, when a patient is diagnosed as COVID positive, they are morally they are becoming so much down as if they got a death sentence in that way. So, so they are definitely we have to cope up with their stress factor. We have to manage the patients. What Madam told, we have to go hand in hand with the patient. By hand holding, we have to maintain the patient throughout the day. Then definitely also there must be some diet and lifestyle is also important. So that also has to be managed. And each and every patient, because Ayurveda is a personalized medicine, we have to customize the medicine depending upon the sign and symptom, depending upon what are the associated comorbidity. On that way only we have to change the medicine. And many questions also asked how to cope up, or why the treatment was not given to the Ayush doctors. So definitely it's a matter of regret that we could not get the chance to treat the COVID-19 patients. But in some states, like in Delhi and Haryana, in Delhi and Punjab, the mild cases were given to the Ayurvedic people, because some of our students are working in Chandigarh in one college, Dhanvantari College. So the patients, those who are treated by PGI, and the patients, if they are not having any sign and symptoms, they were shifted to that particular Dhanvantari hospital, and they were treated by Ayurvedic physicians. Like that, so many patients, like in CBPSC and in AIIA also, many patients were treated. And today morning only, I got a WhatsApp message in our Amrita that now in Kerala government also they are asking, we can get the help of Ayurvedic doctors and homeopathy doctors to tackle this situation whenever there is a asymptomatic cases. But this is a very good start, we can tell. But in other, till now, in other states also, even the Ayush doctors are not recognized as COVID warrior. That is also a matter of regret. So anyway, madam, it was a very good talk, and so many questions, so many doubts has been cleared regarding the treatment of this COVID-19, and definitely we'll try to incorporate if we are getting the patients of COVID-19. So finally, a big thank to Madam Dr. Girija PLT for her benevolent idea of managing COVID-19. Thanks for giving excellent coverage. And also, I wish to express my gratitude to Swami Shankaramutananda Puri. Initially, he was not there, but anyhow, he joined us, our medical director, for providing encouragement to conduct this discussion. And I must mention my deep sense of appreciation to Dr. Ram Manohar, Director Acharya, Amrita School of Ayurveda. I would also like to take the opportunity to place on record my hearty thanks to Dr. Anantram Sharma, Professor Panchakarma, Amrita School of Ayurveda, because he is the only person who managed the entire session by asking the questions. And the session was initially targeted to be 1 hour, but it became almost 2 hours. So because the people have enjoyed a lot. And simultaneously, I extend my thanks to all my teachers. I congratulate the team who has organized, the Acharya team, for this wonderful session. So thank you one and all. Namaskar.
So yes, we will be just ending the broadcast in a short while. So thank you.
Thank you.